There's a lot of fertility myths in the internet, and in this video, we're gonna bust some of those myths. I'm Dr. Moayeri, owner and founder of OC Fertility. Here are the top 7 fertility myths. Number 1, stress causes infertility. It definitely contributes to any health risk, but it's not the cause of infertility. So we obviously want to reduce stress because it can be a factor that increases other health risks, but it is not the cause of our health problems. Myth number 2, birth control pills use causes infertility. Well, when you're on the birth control pill, it does its job. It prevents you from getting pregnant. And of course, women use birth control pills typically when they're younger, and in the meantime, they age. And so when they come off birth control pill, they're surprised to find out now that they're older, they might have trouble getting pregnant. So it's not the birth control pill's fault, it's the fact that you're older now. So it's really not birth control that causes infertility, it's aging. Myth number 3, infertility is just a woman's problem. That's not true. Up to 50% of the time, there's a contribution from the male side, and about 20% of those is exclusively male factor. It can be hard sometimes to encourage the male partner to participate, but it's a team sport and we want to make sure that both parties are participating if it's a heterosexual couple. Myth number 4, position matters. That would be great because you could probably use that to not get pregnant, but of course the position you're in, putting your legs up is not going to help the sperm get up, just like standing up is not going to help them get out. Myth number 5, that once you get pregnant, you shouldn't have trouble getting pregnant again. In fact, the older you get, the harder it may be to get pregnant. So secondary infertility is often more common than primary infertility. And the difference is people who already have kids at home may not work as hard to have future children. So treatment for secondary infertility may not be as common as treatment for primary infertility. But having trouble getting pregnant as you get older is more common. Number 6, this is a hard one. People often think that if you're healthy, you should be fertile. And certainly being healthy helps improve fertility, but it's not true that just being healthy means that you should be fertile. And it's frustrating to a lot of people because they feel like they're doing everything right and that means that they should be fertile, but your fertility is not correlated specifically with your health. And it's like any other medical condition. You can do everything right and still have infertility. For instance, you might have endometriosis, you might have an ovulatory disorder, there could be issues with your partner's sperm, there could be other conditions that are preventing you from conceiving that aren't going to be diagnosed if you don't see a physician. And finally, in many cases we don't know the cause, but a lot of our treatments can be effective in those situations as well. Last but not least, myth number 7 is that it's all about timing. And the truth is most pregnancies are unplanned and unintentional still today. Despite our improvement with education and contraception, people still are primarily having unplanned, unintentional pregnancies. So if you're having intercourse at least once or twice a week and you're using those apps and you're using your ovulation kits and you're not getting pregnant, realistically after 4 to 6 months, and if you want to wait up to a year, you should definitely seek medical attention. We see a lot of patients who wait years before they seek medical attention because they think they're not getting the timing right, and timing is rarely the cause of your infertility. So if you've been struggling to get pregnant, or if you want to start a family or plan for your future, there's a lot of myths out there and it's important to get the facts right. So if you're looking for answers, make sure you talk to a physician who's experienced in treating fertility.